Well, thank you, Mr. Chair, and I want to thank you and Ranking Member Wyden for this hearing today. I want to thank all the witnesses for being here today as well. A couple of observations. One is that breakthroughs aren't breakthroughs if people can't afford the medicine that produces the breakthrough. Secondly, as you have all mentioned, the importance of a viable and predictable system. It has to be a viable and predictable system for patients. And right now, it is so convoluted and so non-transparent that my constituents can't figure out what the price of their medication is going to be day to day. And despite a wonderful staff, I feel like I need a PhD in prescription drug pricing to understand how the heck this industry works. And that should not be the way we proceed in this country to get these breakthroughs to people. But I want to talk about a slightly different aspect of your industry right now. We've been talking about drug pricing, which is one part of how drug companies make money. The other part is how you maximize sales. So, Ms. Taubert, I'd like to focus on how your company maximized sales for a particular class of drugs, opioids. Can you define for me, please, Ms. Taubert, what pseudo-addiction is?
I'm sorry, I'm not sure. I'm not familiar with that term.
Well, let me fill you in then. Pseudo-addiction is an unproven and dubious concept that asserts that certain patients present signs of addiction because they were prescribed insufficient doses of opioids. Those peddling this pseudo-addiction concept say that instead of providing addiction treatment when somebody shows the signs of addiction, the doctor should increase their opioid doses. Even one of the original doctors who pushed this theory now admits it was, his quote, an excuse to give patients more drugs. Ms. Taubert, Janssen promoted this made-up concept of pseudo-addiction on a website that it approved and funded that was called Let's Talk Pain. Since then, your company has repeatedly said that your actions, quote, in the marketing and promotion of our opioid pain medicines was appropriate and responsible. So, Ms. Taubert, how can you possibly claim that promoting the theory of pseudo-addiction, that doctors should prescribe more opioids to patients showing signs of addiction, was appropriate and responsible?
Senator, thank you so much for that question. You know, abuse and addiction, particularly opioid abuse and addiction, are very serious public health concerns, and we recognize the impact on the American public.
So then the question is, and again, like everybody else, I've only got a few minutes here. The question is, why are you looking back at what your company did, promoting pseudo-addiction, an unproved theory that was just used to maximize sales of a deadly drug? Why is that something that you are calling appropriate and responsible?
So I'm sorry, I'm not familiar with the term. What I can say is, on behalf of our company, opioids represent less than 1% of our product sales.
All right, let me stop you right there, because my constituents don't care about the percentage.
Yeah.
They care about the behavior to maximize sales in an industry. Do you know how many Americans died from drug overdoses in 2017?
Far too many.
70,237. In 1 year, more Americans died from drug overdoses than died fighting the entire war in Vietnam. And the vast majority of those overdose deaths, about 50,000, were from opioids. My constituents are dying. Nearly 500 people in New Hampshire died from overdoses last year, and nearly 500 the years before that. And companies like Janssen and Purdue Pharma fueled this epidemic, employing deceptive and truly unconscionable marketing tactics, despite the known risks, so you could sell more drugs to maximize your profits. And now you're refusing to take responsibility for your company's role in this crisis. So one more time, do you truly think that Janssen's opioid marketing practices were appropriate and responsible? Or will you finally take responsibility for your company's role in helping create this crisis that is killing more than 100 Americans every day?
Everything that I have seen leads me to conclusively believe that everything that we have done with our products when we promoted opioid products, which we stopped marketing a long time ago, was very appropriate and responsible. However, that being said, we do believe that we have a leadership position to take in helping with this. And so we are doing a number of things in terms of mothers and babies and physician and patient education to
So-
help and
so
to
let
help
me-
stop, because we recognize
again, our
we all
time-
play a part in trying to help this, because we realize that this
Our time is done, but right now, it is hard for me to take the industry's goal here as promoting good health seriously when its behavior to maximize sales of opioids created an epidemic.